This is my student support system. Keep watching, keep learning.
Now we come to the procedure administering oral medication. The drugs given orally are intended for the absorption in stomach and small intestine. The oral route is most commonly used route for drug administration. It is usually the most convenient and comfortable for the patient. Before giving oral medication, a medication tray should be prepared and client should also be prepared as we do in other nursing procedures as well. Steps of giving oral medication. Always keep rights of the drug administration that we have just studied in mind before preparing medicines for oral administration. Prepare medication tray which should contain drug card, ounce glass, water container, feeding cup, medicine cup, face towel, kidney tray, paper bag, teaspoon, drinking straw, dropper, etc. Greet the client and explain about the procedure. Wash hands before starting the procedure. Now confirm the client's gag reflex and ability to swallow. Assist the client in sitting position and give oral medications one by one. Stay with the client till all medications are taken. For liquid medicine, use ounce glass to measure for proper measurement. Always provide a drink of fresh water to the client after giving oral medication. For oral medication given through a nasogastric tube or gastric tube, crush the tablet or open the capsule and dissolve the powder in 20 to 30 ml of warm water in a cup. Check the placement of feeding tube or nasogastric tube before installing anything but air into the tube, and just you can listen the proper placement of the tube through stethoscope. For sublingual medication, instruct the client to place the medication under the tongue and allow to dissolve completely. Place the client in comfortable position after giving medication. Dispose all the soiled supplies, articles, wash hands and proper hand hygiene, and replace all the instruments at their proper place, means aftercare of the articles. Record the medication given with any reactions after the medication. You should record properly. Use a dropper to give the medications to the infant and very young children while holding them in a sitting or semi-sitting position if the client is a child or infant, and place the medication between gum and cheek to prevent aspiration for a younger child. Crush uncoated tablet or empty the soft capsule and mix the medication with soft food such as potatoes, pudding, ice cream, cooked or hot cereal. In this way you can give the medication to the child. Offer the child a flavored ice pop or frozen fruit bar immediately before taking the medication. What is the benefit of this? This numbs the tongue and making the taste of medication less evident. Praise the child for the job well done. After he or she swallows the medication, it will help to gain confidence of the child and motivate him to take oral medication in future also. Other steps for preparation of the articles to aftercare will remain same as we have discussed today.
My student support system. Keep watching, keep learning.